28th to October 20th.
The next section, let's welcome Dr. Sun Chuanhong. She's going to give a section regarding the sleep apnea. That's regarding, the topic is regarding the sleep apnea, the treatment of sleep apnea. The editor for this section is contributed by the Tzu Ji Kaohsiung branch. Let's watch the video. Right now, we are playing the clip. So regarding the vocal cord, that's regarding the Dr. Sun Chuanhong. She's talking about the treatment for the vocal cord. This video clip is from year 2016. So when we have a throat issue, we usually go to see the doctor. The doctor may advise us to have some like herb medicine. But after you eat some, the throat candy, may just damage the taste bud and lost the taste. So her recommendation is not to exceed the 5 or 6 dose a day. So when you use your vocal cord often, for example, the video shows a person who is a radio show host. She speaks a lot. So maybe damage the vocal cord. So So the next clip is regarding the throat cancer. When you lost your voice or all of a sudden, then should just to get the endoscope exam to ensure, there's no cancer tissue associated with that. Then the treatment for the throat cancer, you can use ablation or radio ablation. Then, so the symptom for the throat cancer is, maybe a swallow difficulty. So, okay. So then the next clip is regarding the Dr. Shen's father. When his father become her patient. So he has a sleep apnea. So when he lost weight, then the symptom kind of improved. Especially for the people when snoring when they sleep. Then many people suffer sleep apnea. They kind of always feel tired, even after in the morning after a long sleep. The doctor's father, Mr. Sun, he also suffered different symptoms related to the sleep apnea. So one of the requirements from the Dr. Sun, she wanted her father be able to reduce weight. So there are many type of treatment that can cure the sleep apnea. So Dr. Shen's father kind of recommended, he trusted his father, trust his daughter. Okay. So right now, you can see as Dr. Sun. The hostess is introduced Dr. Sun. And Dr. Sun, she said that she is quite surprised. Today, she saw all the old clips she had from the news interview. And for the case of Dr. Shen's father, that's what she's going to present. It's regarding sleep apnea. I love to be with you because you have a positive energy. Okay, so I just saw my father. Her father is kind of recommended her not to say something. I'm the doctor of laryngology. So she's always treating. She's part of the 慈济台中慈济 ENT ear nose throat department. In her family, not only her father, also her brother suffers the same issue, sleep apnea. Let me introduce myself. I was born in Tainan, but I'm growing up in Kaohsiung. So I was attending Tzu Chi University from year 2003 to 2010. So she came from a rural area in Tainan. So she graduated from junior middle school. She is the only person who will be able to pass the exam to attend the Kaohsiung Girls Senior High School. So after she graduated from Kaohsiung Girls Senior High School, she attended Tzu Chi University in year 2003 to 2010. After she graduated from Tzu Chi University Medical School, she was attending the Changgen ENT department from year 2010 to 2012 as a resident. But she only spent 2 years in Changgen ENT department as a resident. She kind of like the Hualien Tzu Chi hospital humanistic care. So she decided to move back to Hualien Tzu Chi ENT department, continue as a resident until she finished her residence. Because she is the student of some professor very famous in the ENT area. But when she was a fellow to a famous professor, her professor suggested her maybe she should go to encourage her to study more. Like that's why she went to University of Pittsburgh Medical Center as a fellow in year 2016. Her professor also encouraged her to build a department specialized in laryngology. So what is she is explaining what is the sleep apnea. So there are 2 types of sleep apnea. One is constructive sleep apnea. Another type is central sleep apnea. For the central sleep apnea, usually, it's hard to discuss that. That was because the brain cannot send the correct signal to control the breath. So what is the prevalence of the sleep apnea? We always thought it only happened to the elderly people. But that's not true. So for the male less than 60 years old, so the prevalence is about 24%. So for a female, so like 8 people within every 20 people, they have sleep apnea. So, but they are very low diagnostic rate. It's around 80 to 90% patient, they are not diagnosed as a sleep apnea. That's according to the World Association of Sleep Medicine. So what are the symptoms of sleep apnea? So there's divided to 2 parts. One is happen in the daytime, and another part is happen in the nighttime. So in the daytime, sometimes when they wake up in the morning, they feel like a headache. They cannot focus. feel tired all the time. So the symptom at night usually is a snoring. Snoring during sleep, but it's not only limited to snoring. Sometimes a coughing too, dry cough. So, but usually dry cough during nighttime may contribute to the cause of obstructive airway. So saliva, kind of choke by saliva. Or during the night goes to the restroom often. Not necessarily contribute to the prostate. Maybe just when you wake up at night, you always want to go to the restroom. So not necessarily because you want to go to restroom, so you wake up. Sometimes it's because you wake up, so you want to go to restroom. So how can we tell if we have a sleep apnea? So the cause of the sleep apnea is when we sleep, the upper airway, respiratory tract kind of collapse. So kind of block the airway. So make the oxygen exchange become low. So because the oxygen level at the blood is kind of low, so you feel tension all the time. So one of the symptoms for the sleep apnea is easy to wake up. So now you can see the 3 diagrams. So you can see the respiratory tract. When the airway is blocked, so then when the airway got blocked, then you will hear snoring. The snoring is because the airway is obstructed. The side effect be for brain maybe cause cannot focus or dementia. And the stroke too. So for cardiovascular system, maybe have a high blood pressure, arrhythmia, coronary vascular disease, or heart failure. For the endocrinology, so maybe they may cause the side effect may be something like diabetes, obesity, or metabolic symptom. So for the so for the renal system may cause the impotency. So for the other side effect, sometimes it's a low immunity. That's all because they don't have a good sleep at night. Then due to the sleep apnea. So sometimes sleep apnea is very similar to DUI. So the chance of car accident when the patient have sleep apnea is very similar to the driving under DUI. So how can we tell if our family has such disease? So there is a Epworth sleepiness scale. So you can see when you sitting reading, when you watch TV, or in a quiet place in the public area, and driving when you hit the traffic or stop during the traffic light, do you feel sleepy? So the table in the previous slide provide assessment. You can just to put evaluate to give a score. Then if your score is below 10, then that means normal. If the score between 11 to 12, then they have a minor sleep apnea. If the score between 13 to 17, then we'll kind of meet the level of sleep apnea. So when the score 18 to 24, they become severe sleep apnea. So then the next slide is showing the diagnostic tool. So the first one, the instrument called the PSG, polymomography. So it's an exam, and that exam has to be in the hospital. The patient has to stay in the hospital overnight, sleep in the hospital. So there's a sleep technician. The technician, but it's kind of a very long queue to be able to get this exam. So then, because the first one PSG has to perform at the hospital, so another type of instrument is home sleep testing. So meaning that instrument you can take the exam at home, take the instrument and do the exam at home. In the future, there's like a button-like instrument. They can pin on your collar. They can just record the sound of your breath at night, and this is a wireless instrument. Then they can record the breath sound, then make a diagnosis. They can record they can record when you sleep at home. So there's the two types of examining tool can diagnose the sleep apnea. So after the exam, they will provide AHI index. They will count per hour how many breaths you cannot take any air. So depends on the score, the index. Less than 15 will be minor. 15 to 30 will be intermediate. Then the severe will be above 30 index. And also to detect the oxygen level during sleep. Oxygen level in the blood during sleep. Or when you go to hospitals, also another tool we're going to use is a sleep endoscope. So the endoscope can it's a the endoscope is an exam. They will analyze the narrow area of the airway. So then will depends on anatomic location. So they will examine the four areas as shown on the diagram. So after she confirmed the diagnosis, she will make the personalized treatment plan. So usually the treatment plan will include weight loss, continuously use pressure respiratory instrument, high pressure respiratory instrument, or go through the surgery. So as shown in the video clips, so like my father says that he also went through the surgery. So she gave her father the treatment plan. The first one is to lose weight. So when the person has obesity, the fatty tissue will distribute to all over the body. So to reduce weight is kind of important. Once the weight reduced, so then the fatty tissue on the soft tissue of the throat also reduced. So that will be able to improve the airway. Okay, so the next treatment is a CPAP, which is the positive pressure respiratory instrument. So that is for when the patient, for example, he only be able to breathe like 1 liter air. Then with that instrument, the instrument can give the high pressure, so the patient now can breathe for 4 liter of air. But when you wear the CPAP, there are some issues. For example, you have to wear that, so make the people who may have a claustrophobia. But some patient also complain it's very difficult to wear that instrument when they sleep because they already have a difficulty to fall into sleep. But the Dr. Sun is kind of encourage patient to try that instrument. If it doesn't work, then we can just move on to another treatment. And she also states, with this instrument can help the patient sleep better. So if the patient already reduced the weight, also wear the positive pressure respiratory instrument, then the third options will be use surgery procedure to dilate the airway. So the diagram, the photo she's showing on the screen, is for the sinusitis, for stuffing nose. So the left-hand side is the patient with stuffy nose. The right-hand side is after the procedure, they remove some tissue so they can kind of dilate the airway. So they will also improve the airway, the volume of the breath the patient will have. So that will kind of improve the patient's life. But some patients may not sense they have stuffing nose. Yeah, the patient may not sense that they have a difficulty to breathe. Or so if the nose kind of obstructive, then the patient, of course, has a very low, kind of has a narrow airway. So another surgery procedure to treat this sleep apnea. So they can kind of open the airway, the throat, open the throat to make the tissue, falling tissue, back to the normal state. During the, in the research, the patient who has sleep apnea is not only one place, what has a kind of a narrow, it's not only one place of the airway get narrowed. So maybe there's a couple of places. For example, when the patient sleep, the tongue root may just fall behind to block the airway. So, because the progression of the new technology, so there's a new treatment to treat patient. They can avoid. They can be cured of the sleep apnea. So the latest procedure treatment is to ablation of the tongue root soft tissue. So then another procedure is the Da Vinci. Da Vinci is a surgical robot. So you can see that's the procedure. So the doctor will control the robotic arm. And doctor be able to view the location of the surgery. Very clear view. And the lesion, the cut, or the damage will be kind of non-invasive. Yeah, that's again, it's showing the tongue soft tissue, tongue root soft tissue remove. So you can see the respiratory tract. So the airway now is narrowed as like a straw. So it's not enough. So the doctor, you can see they use endoscope, the instrument, to remove the soft tissue of the tongue root. They can just remove that tissue precisely by using the surgical robot. And they can remove that tissue at one procedure. This treatment even though for a person who never know the human anatomy, they can feel, to remove that soft tissue is very precise. So the successful rate. So now Dr. Sun is showing the surgery before and after. So the doctor, some suggest that the first step should be reduce weight. The second one is to wear the respiratory instrument. The third option will be to have a surgical procedure. So the successful rate in the past, according to the publication, is 50 to 75%. But now in Tzu Taichung Hospital ENT department under Dr. Shen's supervision, the successful rate now can be improved to be 81%, 82%. So it can reduce the AHI index, can reduce 24. So to treat sleep apnea is not only one treatment. There are a couple of treatment. So that's you can discuss with Dr. Sun, and she can help. The last slide, the little baby is Dr. Sun's kid. Yeah, Dr. Sun's father kind of reduced around 15 kilogram. Oh, now he reduced 12 kilogram. So make him much better. I can see the audience is kind of concentrate and listen to Dr. Sun's presentation because this is kind of a common issue for many people.
Okay, thank you, Sister Jean. I'm going to take over from you.
Okay, thank you.
Thank you. So Sister Mayun is reading out some of the real-time feedback from. So there's a question around asking like sleep apnea. How was the percentage of it? And then Sister Mayun was asking about the operations, like how long does it take to perform the operations? And according to doctor, it's actually 30 minutes. So the audience actually commented saying that, Dr. Sun's presentation was actually very impressive and her voice is actually very soothing. So one of the audience mentioned that from the presentation, he or she realized, the so-called minor situation of their own body condition actually may relate to this situation. So Sister Mayen is asking the audiences on the site if this is the first time they heard about this sleep apnea situation. So another audience brought up that snoring looks like it's related to this as well. According to Dr. Sun, if it's the upper part of the nose area, so perhaps some of the spray, medicated spray can actually help reduce the snoring situation. So an audience is asking if Dr. Sun's father saw this presentation, how much points will he give to her? So absolutely, the father will be extremely proud of Dr. Sun. So thank you, Dr. Sun.